Okay. Well, I'd like to welcome our members of the media and those viewing the live stream to today's press conference with the Blue Ridge Health District. We are scheduled to begin at 2 p.m. My name is Joe Rice with the City Communications Office. We are hosting the Zoom webinar, and I'll be moderating today's Q&A with our credentialed media in attendance. Just a few notes before I hand it over to Catherine Goodman, who is the Blue Ridge Health District's Public Relations and Communications Manager. After all speakers have presented, we will give each media outlet 2 opportunities to ask questions, and both opportunities will include your initial question and 1 follow-up question. We will make sure that everybody gets a chance to ask their first question and follow up before we move on to the second round of questioning. As always, please keep your questions respectful and thoughtful for all of our participants. We appreciate your participation, and with that, I'll hand it over to Catherine Goodman. Catherine?
Hi, everyone. Thank you for joining us today. I'm Catherine Goodman, the Public Relations and Communications Manager for the Blue Ridge Health District, formerly Thomas Jefferson, but we started off this new year on a new note. And as we head into COVID vaccines, we figured this would be a good time to gather everybody to provide the latest updates on our health district's COVID-19 response, both with our cases and our vaccination plans. So today we have Dr. Denise Bonds, is the medical director for the health district, and Ryan McKay, who's the director of policy and planning for the health district, as well as our COVID-19 incident commander. We will start off with a brief presentation from Dr. Bonds, providing the latest updates on our plans and initiatives, and then we will open into a question and answer. So thank you for joining us, and I will let Dr. Bonds take it from here.
Good afternoon, everyone. If I can have the first slide, please. And okay. All right, so I thought I'd start today by just giving everyone an overview of where we are with regard to this pandemic. So far in the district, we have had just shy of 10,000 people who have had a diagnosed confirmed case of COVID-19. There have been over 400 of those individuals that have required hospitalization, and I'm regretful 103 individuals who have died because of COVID-19. Our current positivity rate, that is the percent of tests that are conducted that are positive for COVID-19, is just under 6% at 5.7. This is actually down from a high earlier this month of 10% and is lower than the state generally. We have had a very large surge of cases following the winter holiday. And so this has created some challenges in our case investigation. Because of the surge and the large number of cases, I do want people to understand that not everybody who tests positive will get a call from a case investigator at this point in time. This is a change, and it is directly due to the large number of cases. And as our caseload reduces, we will again resume calling all individuals who test positive. But right now, we are really trying to focus on those individuals who test positive who are in high-risk groups or high-risk settings. I would also just like to thank everyone who has called our hotline, but also just let everyone know that it's been a bit of a challenge this week. We've had over 5,000 individuals call our hotline, and we recently switched from having somewhere between 2 to 3 operators in our health district offices to actually working out of a call center space that is being lent to us courtesy of UVA. And having somewhere on the order of 10 to 15 individuals answer that hotline. So we are getting to all of the calls. I would ask people to just be patient. We know that there were some challenges this week and we're trying to address those, but we are looking forward to being able to answer all of your questions going forward. Next slide. So now what I'm sure everyone wants to understand, which is our vaccination plan. So there is a vaccination shortage, and I just need everybody to understand that. There are 5 million Virginians that are currently eligible to receive a COVID-19 vaccine. Virginia gets each week 105,000 doses for the whole state. So you can see there is considerable demand and not much supply. Going forward, starting next week, the Blue Ridge Health District will receive 2,950 first doses each week for the next 4 weeks. That number was given to me very late in the afternoon on Wednesday, and that is a very recent change. Prior to that, we ordered what we needed for the next week, but the state quickly realized that they were getting twice to 3 times as many orders as we actually got vaccines, so they have switched to a per capita distribution system. So that 2,950 represents the percent of population that lives within the Blue Ridge Health District. We have a number of individuals who have appointments on the book, and any individual with a current appointment will get vaccine. We have enough vaccine and we have accounted for that. Individuals who need a second dose will also get a vaccine. That 2,950 represents first doses only. Second doses are distributed in a separate distribution system, and we will contact individuals on a week-by-week basis to make sure that those people who need a second dose are given an appointment so they don't have to compete, as it were, in the general IT system. We are right now trying to get through and prioritize our 1A individuals, and we have partnered with Sentara Martha Jefferson Hospital to do this. They will be reaching out to 1A providers that are on our list that we have not yet been able to vaccinate, and over the next week or so, we'll be contacting you to schedule times to come in. If after that, when Sentara uses its in-stock vaccine, there are still 1A providers, we will work to provide other vaccination opportunities for this group. We realize that your profession puts you at high risk, and we are dedicated to getting you vaccinated, but we do have a limited supply. Can I have the next slide, please? We recently opened up vaccination to phase 1B. This was a request by the federal government and an encouragement by our state government to really begin to offer vaccine to those who are at highest risk of having an adverse outcome if they're impacted. And that would be individuals who are over the age of 75 and to a large degree those over the age of 65 or those younger with comorbidities. So we have begun partnering with UVA to really reach out to those individuals at highest risk, those who are over the age of 75. So far, 1,500 individuals have had their first dose. There's an additional 4,200 that have appointments made for that first dose, and we will be sharing additional individuals that have registered interest with us, either through our online survey or through the hotline, and we'll be sending that list over to UVA, and you should be getting an invitation at some point in the next week or so. Please be patient. We are trying to make sure that we offer to anyone over the age of 75 a vaccine, but again, it's going to take us some time to get through the entire list. We do have surveys open to collect information for other individuals in phase 1B, but please fill one out, and you should now get a confirmation email, but that does not give you an appointment time. That just gets you on the list, and then when your turn comes up, we will contact you and explain how to schedule an appointment. I want to set very clear expectation. At our current rate of receiving vaccine, it will take months to vaccinate all of the individuals that qualify under phase 1B. We will work through as quickly as we can, and I am optimistic that there will be additional vaccine being produced or distributed by the federal government, but I do not have any knowledge of that right now. Additionally, there are other vaccines in the pipeline that should have final phase 3 clinical trial results in the next few months that will expand our capabilities. But given the current amount of vaccine, it will take months to vaccinate phase 1B. Can I have the next slide, please? So, next steps. We did open 1B before we completely understood the vaccination shortage, but we feel like that's still the right decision because that is the group that is the highest risk of dying. We are prioritizing particularly within 1B, those individuals over the age of 75 that really have the highest risk. And if you have signed up, we are working to get your name over to UVA, who will then contact you for an appointment. As you said, it's going to take months. Please be patient. We're going to try to use appropriate medical prioritization and equity as we develop all of our plans. We know that COVID has disproportionately impacted people of color, and we are taking that into our planning considerations as we move forward. We are trying to figure out the best way to prioritize this vaccine as we move forward, and are having lots of conversations with community partners about that. Finally, VAMS, which is the IT system that we're using, has presented some challenges with regard to scheduling appointments. Please understand that we will be moving to a new system and will operate both simultaneously over the next few months as we work through everyone that is in VAMS and then move to our PrEP mod system. Can I have the next slide, please? So in closing, we're not there yet. There is a light at the end of the tunnel. It's a good light, so we're going to get there, but it's going to take a little bit of time. And we need everyone to continue those great mitigation strategies that we have all become so good at. Please continue to wear your masks. Please continue to maintain physical distancing. Wash your hands frequently and properly. And please limit your social gatherings, particularly with other households. We know that this has been a huge source of infection, particularly recently. And so really we ask that you try and stay within your own household and do your socialization via Zoom or the phone call. We know it's been a really long year. I appreciate everything that everyone has done to keep our community safe, and I just need you to keep doing it for a few months more. And I think that's the last slide if you want to move. So there is our hotline number. We are completely staffed up and have lots of phones to answer. And so we welcome the public's questions, and I would be happy to answer any questions that you have.
Thank you, Dr. Bonds. Again, this is Joe Rice. And with that, I would like to invite our credentialed media to ask questions. If you would like to participate in the Q&A, please click your raise hand icon and I'll call on you in the order of hands raised. When I call on you and activate your mic, you can then ask your first question and one follow-up question. We'll give each media representative 2 opportunities to ask questions in this format. And our first question comes from Mr. Joe Thomas with Monticello Media. Joe, you're on with Blue Ridge Health District.
Dr. Bonds, thank you for holding this event. You said that you opened up to 1B before you fully understood the shortage. So there was a shortage you were aware of before we opened up to phase 1B?
So we always knew that there was a limited amount of vaccine available, but we had not been given specific targets or the exact amount that had already been distributed to hospitals and pharmacies for long-term care facilities. And we had not had any indication that we would not get what we ordered for clinics the following week. That really only happened the week that we said we would move to 1B. So we know now, and we will, as I said, honor all of the individuals in there, and we will continue to work down the phase 1B. And in fact, I still think it's the right decision because it does contain our most vulnerable group, those that are over the age of 75, that really we know, looking at the numbers, are most likely to have a hospitalization or a death from COVID.
Thank you. My second question is based on Becker's hospital reviews, been making the rounds for about the last week in the news wires. It says Virginia had received just under 1 million doses, 992,000 doses administered, 362,000, 36% distribution rate, ranking us 49th in the nation. That doesn't seem to juxtapose with the shortage. Can you square those numbers up for us, and why is there a disparity in that reporting?
Yeah, that's a really great question. So I think a couple of things are at play here. The first is that a lot of the initial doses went to hospital systems to focus on healthcare personnel, and that's been challenging, and many of them, it's taken a little bit of time, but they have stepped up to the plate. Certainly our two health systems have really been instrumental in helping us reach out to priority groups. The second is that about a fourth of that vaccine that has been distributed to us went into a holding refrigerator, as it were, for the federal program with Walgreens and CVS to vaccinate long-term care facilities. That program has not rolled out nearly as quickly as they had anticipated. And so it's taking a lot longer for those pharmacies to get into all of the long-term care facilities in our state. And so that vaccine is in a holding spot that we can't access, but it's not been put into someone's arm. And then finally, I think one area that's really playing into this is that the count is via an immunization tracking system. And while we have a great way of integrating that, and that was required, there are some distribution sites that are not directly integrating into that vaccine counting. They're using a paper-based system, and there's a backlog to get those entered into the VIS system, which is how we count. We have been instructed by the state that must be corrected by this weekend. We don't have any, so we're in good shape here, but there are other places across the state. I think what you will see is in the next week that disparity between dispensed and immunized will shrink dramatically. We certainly have been given our marching orders. And we are committed here at the health district that every vaccine that we receive is put into someone's arm that week. And we will move towards that next week. We spent an hour and a half planning that, and we will continue that moving forward.
Okay, our next question comes from Jesse Higgins with Charlottesville Tomorrow. Jesse, you're on with the Blue Ridge Health District. Jesse, I'm going to enable your mic now.
Hi, can you guys hear me? Yes? Okay.
We can, yeah.
So my question is actually about the folks that are remaining in 1A. Can you tell me how many are yet to receive a vaccine?
It's a great question, and no, the short answer is no. When someone registers, they register for their entire organization, and then we make them a point of contact within the VAM system, and then they upload all of the employees within their particular practice. And so we don't actually, we have some, no, in fact, we don't even have that. We have counts of the number of practices, and as I said, Centera Martha Jefferson is moving through that list. I will say every day I get another email from somebody who says, wait, I didn't get on the list yet. Can I get on the list? So it's really a moving target. We will continue to prioritize. We know that these individuals are particularly high risk, and we're just very grateful to Centera Martha Jefferson for partnering with us to make sure that these individuals get vaccine in an expeditious fashion.
Okay. In that case, can you tell me how many of these individuals have received a vaccine in the health district? How many from 1A?
No, actually, I can't tell you that either. You can look on the website and you can see how many, because 1A also includes all of our hospital personnel, right? And so as a health department, we only vaccinate a fraction of the 1A. The hospitals in and of themselves vaccinated all of their employees and affiliates, and so I don't have that count. You can go on the website and you can see the total number of individuals in our community that have received both their first dose and their second dose. I'm sorry, I didn't look yet today to see what those numbers have changed. It was, I don't know, about 5,000, I think, each for Charlottesville and Albemarle, but go and confirm that on the website. Just look at the map and toggle over. And so that would include everything that the hospital has given, both hospitals, and then everything that has been provided through the health district. Most of those will be 1A at this point in time.
Okay, our next question comes from Carly Haynes with CBS 19. Carly, you are on with Blue Ridge Health District. You have a question and one follow-up.
Hi, everyone. Can you hear me okay? All right, awesome.
We
I'll
can.
just ask my two questions together. Have any other groups reached out to you about hosting a mass vaccination clinic or site? And can you explain whether or not you'd be open to that?
So you know what, I'm going to turn this one over to Ryan as our COVID incident commander and let him field this one.
Thank you. Yes, we have seen and heard from a number of partners who want to host a site at their location, primarily from different schools who have the larger spaces that are needed to run people through in large volumes. We will consider other spaces. In fact, University of Virginia is looking at another space right now that would be open, that would be high volume. I think for us, we have to wait for the timing. So while we have the nursing staff and the vaccinator staff to operate these sites, the lack of vaccine prevents us from opening other sites. So we're really trying to pool resources into single locations that maximize our resources. For example, we need to send one of our public health nurses to any site we operate because we're in charge of the cold chain management. And so it's best if we use our resources currently at the Kmart location. But as vaccine is made more available, as we build up that additional capacity to staff those locations, we would certainly consider alternate locations to operate.
All right, perfect. Thank you.
Okay, our next question comes from Rachel Hersheimer Rachel is with NBC 29. Sorry, Rachel. You are on with Blue Ridge Health District.
Can you guys hear me? Hello.
We can.
We can.
So my question is, what are you doing with leftover vaccines at the end of the day? Are you able to use those extra doses for people who are just lingering around? I know that I've seen this in other parts of the country.
So first, we try never to schedule the wrong number of individuals. We try and schedule in increments of 5 or 10, depending on whether we're doing Pfizer or Moderna vaccine. That said, we do sometimes get extra doses out of both types. Sometimes you can pull a 6th out of a Pfizer or 11th out of Moderna. And we do have the rare no-show. So we have a list of individuals that are in that phase 1A or high phase 1B group that we can contact that we work down. So we discourage people from just doing drive-bys. We do have a system. We never waste doses. I assure the public that if there is a dose, we get it in, and we have a prioritization list. We're continuing to refine how that will be, and obviously as we move through phase 1A and past the early phase 1B frontline workers, we'll have to come up with a way to have a priority list for the general public. And so we're working on that now, but please do not come by the tent right now. We generally do not have open doses, and we have a system in place should that exception occur.
And do I have another question?
Yes, make sure you have a follow-up.
All right. So I know that you said this, but with the shortage, is there a chance that people who are scheduled now to get the vaccine, is there a chance that their appointments could get canceled?
I think we looked at this morning, and Ryan, I'm going to look for confirmation, but I know that for at least the next 2 weeks, we have everyone who has an appointment, we have vaccine for you. And I anticipate that that will continue to be the case for the next 4 weeks. Should something change and we need to expand, that's a good problem to have. If suddenly we got more vaccine, we would definitely open up more spots. The state has guaranteed that we will get the 2,950 doses that we should have going forward, and so for at least for the next 4 weeks. So I think no one should get a cancellation notice. Now, rescheduling will be a challenge. So if you can't make that time, I can't guarantee that I can give you another time within that same week. So if you have a time, I encourage you to keep it.
And our next question comes from Sean Tubbs. Sean, you're on with the Blue Ridge Health District. You have a question and a follow-up.
Yes, thank you. I've been going back and sort of reviewing the communications that you guys put out and trying to get a sense of the timing for when you suddenly went and moved forward with phase 1B. I guess I'm trying to get a sense of what the planning had been prior to the decision to do that, because it's clear from the email that you sent out on January 7th that you said early spring, and then suddenly we're at this point. From your perspective, was that part of the plan, or did that sort of come out of left field?
Yeah, no, there's been a lot of different communication, and I will say that there was, we were encouraged to move into phase 1B because that is the vulnerable population, and we always knew there would be an overlap moving between phases, where we were always going to have to do some phase 1A while we were starting up phase 1B. We did not hear about the fixed dose allocation and the absolute number of doses coming into Virginia until Wednesday at 3:30. I can give you the exact time, because that was when the meeting that our Northwest region had, and we were given our numbers. So even the day before, we were still working under the assumption that whatever we ordered was going to be provided. And so it's a swiftly moving target. We're trying our best to give the most accurate information at that moment in time. I think it's always better to have a very pessimistic promise. So I'm saying that right now. It may be months. It'd be great if in a month's time the state comes back and says, gosh, we've gotten 3 times as much vaccine, or the federal government has figured out how to increase the output of Moderna and Pfizer factories, or the Johnson & Johnson and AstraZeneca have both received emergency use authorizations, and we now have those available. But I don't know that that's going to happen. I don't know any of that. So the day that we were given the 2950 is Wednesday this week. So.
Gotcha. And then the follow-up, how closely are you working with Dr. Avula and the work he was hired? I'm trying to figure out the exact date he was hired, but it's sort of in this time. How closely do you work with him, and are you in daily communication, that sort of thing?
Yeah, so Dr. Avula is actually although he's now the vaccine czar, as it were, the vaccine coordinator, he's actually also the health director for one of our neighboring health districts. And so we have always been in close communication. And I would say that he is on calls that we participate in as a state agency at least 3 times a week. He was on a call this morning with the governor and all of the health directors and the heads of all of our major hospital systems. We have that weekly call. We have weekly calls within the Virginia Department of Health, within the health district. We have calls every day. So there's lots and lots of communication going forward. But he was just brought on last week. In fact, maybe even the end of last week. So he's, I think, done a great job and really hit the ground running. Because he is a health director, he really understands how health districts function. And that's a great addition to the planning process.
Our next question comes from Catherine Knott with the Daily Progress. Catherine, you're on with the Blue Ridge Health District. Do you have a question and a follow-up?
Wonderful. Can anyone hear me? Let's play the game.
We can.
So how does the new dose allocation, the 2950, compare to what you all have previously received or requested?
So, I'm going to let Ryan talk about how we've been distributing and allocating doses. Ryan?
So previously, we had been receiving the number of doses that we had ordered, and that order was based on what our capacity is to dispense, both in terms of space, but also nursing and vaccinator capacity. As we built up our capacity to actually dispense both here in Charlottesville, Albemarle, but across the district, we were intending to increase our orders. And so moving forward, the 2950 does fall significantly short of what we know we can dispense in a given week. So what that means, we have to plan a little bit more accordingly in terms of how we distribute vaccine to localities, but also how we apply that distribution to the guidelines that are provided by BDH, and then how we use an equitable lens to make sure that we're reaching all of the hardest hit individuals in the district per the numbers that Denise has shared. So it's a significant challenge. It's really hard decisions that we have to make when it comes to the distribution within 1A and 1B.
Definitely. Is there going to be like an announcement of kind of how you end up divvying that out throughout the localities into the different groups?
Yeah, we're firming up our plans now, allocating obviously numbers per week, and we want to communicate with our government partners before we make any significant announcements regarding that, so that there's a shared understanding of the situation. We've communicated with them as early as Wednesday evening to talk a little bit about the overall distribution that we receive on a week-to-week basis, but then also when providing that information, making sure they're aware of how we're coming to these decisions and where the priorities are in terms of access for dispensing at any of our sites.
Okay, I see Jesse and Joe, your hands are raised for our second line of questioning. A couple of our attendees did not participate in the first round, but I would like to give you an opportunity to raise your hand now if you would like to participate. And with that, we'll go ahead and go on with our second round of questioning. And the first is from Jesse Higgins. Jesse, you're on with BRHD. You have a question and a follow-up.
Hi, can you hear me?
Yes.
So the second question is about the, I believe you called it the VANS system. Can you talk a little bit about what some of those issues you were having were, and then also how this new system is going to address those?
So I'm going to let Ryan handle this one since he's more familiar with the VANS and PrepMod system.
So it's called the Vaccine Administration Management System. It's a system that Virginia adopted and is actually run by the Centers for Disease Control and Prevention. And it's largely been used for inventory, but it also allows us to set up appointments, locations where individuals who have an account can log on and schedule an appointment. And we've had a number of issues. I think one, in terms of identifying a point of contact and getting that individual from the organization access to the system, that's a delayed process where we send the information that we receive to VDH, who in turn uploads it and sends it to CDC. And there was a significant lag time of sometimes 5 to 7 days before the actual account was created, which means that prevents an organization from uploading their staff into the system to look for appointments. I think another significant problem as it relates more to our community is that there's no way for us to manage who has access to those sites. So we can't say that someone is in phase 1A and we get priority over someone who's in phase 1B. And so we've had instances where phase 1B organizations had that data uploaded, accounts were created instantaneously, and then they had quicker access than a number of the 1A organizations. And so there's no way for us to prevent that. There's no way for us to sort of restrict access to those clinic dates and times. And so what we've had to do is learn how to establish a workaround and basically creating more of a controlled environment where we can upload individuals for a site without those appointments being made available. So what we've recently heard and seen is that individuals are frustrated that there aren't more appointments being added to the dates that were scheduled to dispense from any location. Part of that is managing the vaccine allocation to make sure we can cover what appointments are already there. The other is it allows us to prioritize those from 1A and then those from 1B in our most vulnerable populations to give them access to the vaccine. And so it's created a headache certainly for our team, but I think primarily for the community that just doesn't have an easy way to access appointments if they're in 1A versus 1B. And then the new system will allow us to do this a little more easily. So we can create sort of closed environments within that platform that allows individuals specific to that category or that organization or that phase to access those appointments without concern for it being wide open to everyone who's in the system.
Okay, that's excellent. So I guess my follow-up would be, when does the new system begin?
So we are actually one of the 5 health districts that are piloting it today, in fact, this as we speak. And we intend to start implementing that as soon as possible. So as early as next week, or maybe by Friday, new organizations and new groups that are uploaded would be into a new system called PrepMod, as opposed to using the VAMs. It's important to note that those who are currently in VAMs and have accessed VAMs to schedule appointments, those organizations and individuals to a large extent will be in VAMs until we get through the second doses. It does mean we're going to be contacting individuals directly for that second dose appointment, as opposed to being able to schedule that themselves. So there is going to be an overlap. There's still some workarounds we'll have to use to provide access. But hopefully, as we transition out of VAMs and more into PrepMod, this will make for a more efficient use of the system to schedule appointments for those that need it most.
Thank you, Jesse. Next up is Joe Thomas. Joe, you're on with Blue Ridge Health District.
Thank you. Again, this is perhaps a little bit more abstract, but I'm trying to phrase it properly. With teachers being part of phase 1B, what percentage of our teacher population in the Blue Ridge Health District have been able to get the vaccine? And have you been in contact with any of the school divisions regarding whether that should be factored in, whether or not they should go back to in-person lessons?
So I'll start, and then I'm going to turn this and let Ryan add in. So I think it's really important to understand that kids have essentially lost a year of education. I think school teachers. Joe, I'm getting a lot of feedback on my end.
Yeah, Denise, do you have another device that has audio playing?
I do, maybe. Was it me?
I'll
How's that?
mute my mic.
Okay. So I think it's really important for us all to understand that while teachers, I think, have done a great job trying to provide quality education over an online system, it's really challenging, particularly for our youngest learners. And so we need to make sure that our teachers feel safe so that we can get children back in school in at least some fashion. Of course, we cannot vaccinate children right now. Neither of the approved vaccines have been tested in children, although those studies are ongoing. So we really can only vaccinate the teachers. And so there will always be some sort of hybrid model that likely will need to be maintained for the rest of the year. So they are a very high priority group, and I'll let Ryan speak to how to address that.
So we actually have been meeting with a number of public and independent schools on a weekly basis since about July. A lot of that started with what things schools could do to mitigate risk within their school settings beginning in August. And each week we talk about the numbers, what we're seeing in terms of cases, how to address certain situations when it comes to a child or a staff member who is exhibiting potential symptoms of COVID. And so it's been a partnership building process that's included a number of pediatricians from Charlottesville to provide some of that background information and expertise to the situation. In that, and more recently, we've talked a little bit more in depth about how to provide access to teachers and staff, including janitors, the individuals, bus drivers who are working very closely with students in these settings. And so we wanted to leverage their facilities. We want to leverage the nursing staff who are interested in becoming vaccinators, so that we can also create some space in appointments within our dispensing sites. So calling it sort of a specialty point of dispensing, where schools would combine resources and run these sites, obviously with our supervision for cold chain management, but also provides an opportunity for us to train those school nurses to then in turn vaccinate their staff. those conversations have been ongoing. I can't say how many teachers to this point, based on percentage, have received the vaccine. Some were able to gain access to appointments. Other schools have been able to start their process. So we have a group meeting within Charlottesville and Albemarle, and then we've also been meeting independently with each of the localities to talk about that process and to get that moving forward as early as this week and next week to provide access to the vaccine. It will take time. I think all the schools would appreciate the ability to run their own sites and vaccinate all their own individuals. But we just, based on the resources, aren't able to do that. So working with them collectively to be able to provide access, leverage the resources that are available, and make this sort of a unified approach to how we do it, and bring those individuals in is going to be critical. And we're on that pathway towards it. And I think it's important to note that we also need to include daycare and preschools in there as well, because they're part of that phase 1B, as well as the Boys and Girls Club. So there's a number of education settings that we have to consider and pull into that to leverage those resources and provide access. And we're working very quickly to execute that plan.
All right, thank you.
Thank you, Joe. And our next question comes from Catherine Knott. Catherine, you are on with the Blue Ridge Health District. You have one question and a follow-up.
Fabulous. I guess kind of broadly, how would you all assess the pace of vaccinations so far? I know UVA is included in that, and the numbers they shared today is that they've administered about 17,321 doses, which would leave 2,000 left in the total that's on the dashboard for the health district. So I was just wondering, like, how are you guys assessing the work so far?
Yeah, I think you bring up a great point. Would we like it to be moving faster? Absolutely. We needed some time to get all of the resources in place. This is an emergency use vaccine. There were 25 hours of education that my public health nurses had to go through, and a pretty extensive skills checkoff. We have to make sure that we are handling the vaccine appropriately so that it maintains its integrity, and that we are providing it in such a fashion that people are safe. So for every new nurse that we bring on, or every volunteer nurse, they still have to go through the 25 hours of education and the skills checkoff. That's requirement by the state. So it did take more time than I would have liked to get vaccine ramped up. That said, I think Ryan and his team have done a really great job. We have a very robust capability, and now the limitation is vaccine. We have lots of people who are available to provide that vaccine. We have infrastructure. We have the logistical capabilities worked out. We have support staff available, but we have a finite amount of vaccine every week.
Definitely. And I guess kind of going off of that, there's been a bit or a lot of frustration and confusion kind of about this process over the last like 2 weeks or so. What do you kind of think that stems from, and how are you guys working to address it? And I'm sure that this press briefing is part of that as well.
Right. There has been confusion, absolutely. And there have been a couple of system failures with regard to IT. UVA had some joint issues with us with regard to getting that over 75 group. They got appointments and they didn't know where to go, and that created a lot of confusion for people. And so we've fixed that. UVA has individuals on site in our hotline center that we can work with, and we have really quadrupled the number of hotline staff so that people can get their questions answered. Going forward, we will have more links on our webpage to what people should do for vaccine, and more links about what you should do if you actually got COVID and didn't get called by somebody, so that you know the appropriate steps to take. I think this press conference is really the start of us trying to be transparent about how we're providing the vaccine and to answer questions to the community. We are working to make sure that everyone in the community who wants a vaccine gets a vaccine. We now have the infrastructure in place. We have great partnerships with our 2 hospitals, but also I should say with our EMT units who will also be joining us to vaccinate. The city and county government have really stepped up. All of our locality governments have been great partners. We have the infrastructure in place now to vaccinate many people in a very rapid fashion. We just don't have vaccine to do it. So we will be transparent about the vaccine and as it goes out. And when we hear that we're getting additional vaccine, we will let the public know, but that will not be for at least a month.
So I currently see no other hands raised, but I would like to give this opportunity to those who did not ask in the second line of questioning to go ahead and raise your hand if you do have a question. And there appears to be none. And Catherine, I'll hand it back over to you to close.
Thank you all for joining us today. I would like to reiterate what Dr. Bond said, in that our hotline is working very quickly to answer as many calls as we can. We also are receiving thousands of emails and trying to get through to everybody. We want to be as open and transparent as we can be. So we will continue to host press briefings moving forward. We will also host a public town hall in a couple weeks, and we will make sure that we send out that information far and wide so that everyone in the community has the opportunity to ask us questions directly. So we appreciate everybody's support through this process and your patience, because it has not been an easy experience for all of us. And we understand that the vaccine really provides us hope for getting out of this pandemic, and we want to get everybody vaccinated as quickly as we can. I would also like to quickly thank the city of Charlottesville as well for helping us with the technology and support for today's press conference, and to thank everybody else in our panelists as well, and to let you all know that we will continue to provide more information as we move forward. So thank you all.